The headaches had been getting worse for weeks. He was in his early 40s, still working, still getting on with things. Then one morning, the words stopped making sense. He was reading something ordinary, and the letters meant nothing. His right hand had gone numb. He went to the hospital that afternoon. He was a working professional in his early 40s. His life, by every external measure, was unremarkable in the best way. A job, a family, daily routines that had never given him reason to worry. He had no prior history of serious illness, but over the course of several weeks, the symptoms had been stacking. Persistent headaches that did not respond to over-the-counter medication. Intermittent numbness on his right side. Then, that brief and deeply unsettling episode where language failed him entirely. According to documented case accounts and published medical literature on spontaneous tumor regression, patients describing this specific cluster of symptoms, neurological deficit, progressive headache, and transient aphasia, are almost always referred for urgent imaging. He was. The scan revealed a mass in his brain, large enough and positioned in a way that the clinical picture was serious. The neurosurgeons reviewed the images carefully. The tumor was situated in a region that made complete surgical removal extraordinarily difficult. The biopsy results returned. The pathology was consistent with a high-grade glioma, a category of brain tumor that at the time carried a deeply poor prognosis. His physicians discussed the findings with him directly. Based on the size, the location, the grade, and the behavior of tumors like this, they gave him an estimate: 6 months, possibly less, possibly a little more. But the trajectory, as medicine understood it then, was not optimistic. He went home and tried to decide what to do with what remained. The treatment options presented were limited. Surgery offered partial debulking, reducing the tumor mass, but not elimination. Radiation therapy was recommended. Chemotherapy protocols of the era were less refined than what is available today. He proceeded with the recommended course of treatment. The tumor responded partially. Some reduction in size was observed on follow-up imaging, but the medical team remained cautious. Partial response in high-grade gliomas does not typically indicate long-term survival. The months passed. The 6-month mark came. He was still alive and still symptomatic, but still alive. His medical team continued monitoring him. And then something began to happen that nobody had prepared for. Now here is where the medical records become unusual. On successive imaging studies, the tumor appeared smaller, not marginally smaller, meaningfully smaller, then smaller still. Then, over the course of years, the imaging showed something that sits at the very edge of what oncology expects. The mass appeared to be resolving, not controlled, not stable, resolving. Physicians documented this progression carefully because cases of this type are extraordinarily rare and because the implications, if real, demanded documentation. What the physicians were observing falls under a category in medical literature known as spontaneous tumor regression. It is among the most poorly understood phenomena in oncology. The term describes a situation in which a malignant tumor partially or completely reduces in size without or beyond what can be explained by conventional treatment alone. According to a review published in oncology literature, spontaneous regression of any cancer is estimated to occur in approximately 1 in 100,000 cancer patients. For high-grade brain tumors specifically, documented cases of complete regression are so rare that each one is treated as a case study in its own right. This patient's case became one of those records. Researchers have proposed several mechanisms that may account for spontaneous regression, though none has been established as definitive. The most extensively studied hypothesis involves the immune system. Under this model, the body's immune response, for reasons that are not yet predictable or reproducible, identifies tumor cells as foreign and mounts an effective attack. Studies using functional imaging and immunological profiling have found in some regression cases evidence of unusually heightened immune activity directed at the tumor site. A second proposed mechanism involves the tumor's own biology, specifically the hypothesis that some tumors contain a proportion of cells capable of apoptosis, a programmed cell death process that can be triggered under certain conditions. What those conditions are and what triggers them remains unclear. A third possibility, documented in some cases, is that the initial biopsy itself, the act of sampling the tumor, may provoke an immune response significant enough to alter the tumor's trajectory. This is sometimes referred to in the literature as the biopsy effect, and while it has been observed in isolated case reports, it remains theoretical as a mechanism. Clinicians noted that in this patient's case, the timeline of regression appeared to begin in the period following the initial surgical intervention and radiation. Whether the treatment primed the immune response or whether something independent was already underway, the records do not allow a definitive answer. What the records do show is this: 20 years after the prognosis of 6 months, imaging studies documented no residual tumor. His physicians, reviewing decades of follow-up scans, characterized the outcome as a complete radiological response. Medicine gave him a number. His body did not honor it. And then came a finding that changed how physicians understood this. What this case reveals is not that medicine was wrong in its prognosis. The physicians who reviewed his imaging and his pathology were applying the best available evidence of their era. And that evidence, in the overwhelming majority of comparable cases, led to the outcome they predicted. Spontaneous regression does not invalidate a prognosis. It reminds clinicians and researchers that the prognosis is a probability, not a certainty. What cases like this one have contributed to the field is a growing area of research into immune-mediated tumor control. In the decades since early regression cases were documented, immunotherapy has emerged as one of oncology's most significant developments. Checkpoint inhibitors, drugs designed to release the natural brakes on the immune system, have demonstrated in clinical trials the capacity to achieve responses in cancers previously considered untreatable. The immune hypothesis that was once speculative in the context of spontaneous regression is now a foundational principle of a major branch of cancer treatment. Researchers later proposed that cases of spontaneous regression may represent, in effect, a naturally occurring version of what immunotherapy attempts to engineer. What medicine still cannot explain is which patients carry the biological conditions for this response, and whether it will ever be predictable. For the patient himself, 20 years of ordinary life followed a conversation in which ordinary life seemed to be over. What that experience means, the weight of a 6-month prognosis carried across 2 decades, is not something medicine quantifies. The case records document the imaging. They do not document what it is to be the person inside the scan. The headaches had been getting worse for weeks. He was in his early 40s, and one morning, the words stopped making sense. He went to a hospital, and he was told, with clinical precision and genuine care, that he had very little time. 20 years later, the imaging was clear. No tumor. No explanation medicine can yet fully stand behind. Just a man who outlived a prognosis, and a field of science now trying to understand why. If you had been handed that 6-month estimate and then watched it pass, and then watched another year pass, and another, what would you believe was happening inside you? This video is based on real, publicly documented medical case reports and is intended for educational and storytelling purposes. It is not medical advice. If you or someone you know is experiencing similar symptoms, please consult a licensed physician. Medical Mysteries. True cases every week.